Welcome back. My next guest is Dr. Arvind Bansal, who is a pulmonologist sleep specialist at Baptist Health. Welcome.
Thank you.
I'd like to also, before we get started here and talk about sleep, take a little bit of personal privilege here and just let folks know that you were one of the doctors who took care of me when I was in the hospital and on the ventilator at COVID. And thanks to you, you were able to get me off the ventilator. And you're one of the reasons I'm still here, and I appreciate that.
Thank you. It's an honor and privilege, sir. Thank you.
So let's talk a little bit about sleep. Sleep affects a lot of stuff. If you're not sleeping good, it can affect a lot of chronic diseases.
That is correct. So when we look at sleep deprivation, it can lead to a lot of different health conditions. The big one we talk about is obesity. There is obesity epidemic in this country and all over the world, and sleep deprivation can lead to increased weight gain due to hormonal changes in the body. It is also linked with cardiovascular diseases and hypertension, increased risk of that, increased risk of diabetes. And we started talking about COVID, and immunity needs to be strong to fight back from that. And sleep deprivation has been linked to low immunity as well.
Well, are there things, if you're not sleeping good, are there things short of seeing your doctor, short of taking a medication, are there some sleep habits you can do to see if it corrects itself?
So sleep habits definitely play a big role. It's like going back to the basics, as we used to call it, going to bed at the same time and waking up at the same time. Technology is affecting our sleep a lot during the night, watching tablets, staying on your phone, the light from that affects quite a bit. So staying off all electronic gadgets late on in the evening, turning down the light and not exposing yourself to bright light late in the evening. Then different kind of substances which can affect the sleep, including excessive alcohol use or narcotic agents, which can really interrupt your sleep and not have you have a good night's sleep. So cutting those down. Then again, being mindful and trying to do some meditation before going to bed, or relaxing, taking your worries out of the bedroom, and just try to get a good night's sleep is important.
Now I mentioned snoring, okay? Is snoring necessarily bad, or are there other symptoms that may be, hey, I've got a problem and it needs to be looked at?
So snoring is, in the classic, societal terms, it has been considered more of a nuisance, like, okay, he snores loud and we make fun of people, but snoring has been a big risk factor for sleep apnea. So sleep apnea is interruption of breathing during sleep repetitively, which can occur due to collapse of upper airway. And if that happens, then that can affect your nighttime sleep. It can also lead to a host of different medical conditions which can worsen if it is present in patients.
So how do you make the diagnosis?
Yeah. So initial is history and physical, basically, asking patients about if they're snoring. Most of the time patients come to us with, I snore a lot, my wife or my husband complains about it, and they tell me I stop breathing, and or I feel excessively sleepy during the daytime. So some of those are very early symptoms which patient experience. And so the recognition is the big part of it, because it is still very under-recognized condition. So if we recognize it, then the next step will be to do a sleep study. Traditionally, we used to do in-lab studies where patients come in, spend a night in the hospital, and we diagnose them with sleep apnea. But with the evolving technology, now we can do home-based testing, which is extremely good in picking up sleep apnea. It is convenient for patients because they can do it in their home setting. They don't have to come to the hospital, and it is cheaper option as well.
So you make the diagnosis, there's different treatments.
Yes. So lifestyle changes would be first and foremost, because being overweight or obese is one of the risk factors. We talked about some substance use, alcohols, narcotics, trying to cut those down. Also help with the sleep apnea problem. And if it is a bigger issue or a more moderate or severe sleep apnea, then there are treatments such as CPAP therapy, which is continuous positive airway pressure therapy. It is pressurized air, which is splinting your upper airway open so that you can keep on breathing in and out, eliminates your snoring and sleep apnea problem. There are oral appliances which a dentist can make for patients. So that is alternate option to CPAP, which can also help treat sleep apnea. Surgical options are there where a surgeon goes in and reconstruct your upper airway. That is probably a pretty extreme step, but again, if CPAP is not working, then there are alternative options. The newer option is a device called hypoglossal nerve stimulator, which you install, and it stimulates the nerve which is supplying the upper airways to keep the upper airway open to help breathe better during the night and have a better night's sleep.
That's great information. We appreciate you coming in. So if you're snoring, your partner says you stop breathing, see your physician. You may have sleep apnea. We'll be right back.